If you are here, you have taken an active role in bettering your life, no matter what stage of life you are in. The Banyan Treatment Centers podcast will discuss many topics like recovery, addiction, self-help, mental health, and so much more. It will provide you with tools to succeed, ideas for recovering, and how-tos on creating a better life. My name is Alyssa, and today's episode is about the signs and symptoms of schizophrenic disorder. Today on our panel, we have Kahlia Bersson. Before accepting her position as the National Director of Telehealth Services, she was the Clinical Director of the Mental Health Program at Banyan Boca and has helped thousands of individuals get the help they needed. Thank you so much for joining us today, Kahlia. Why don't you tell us a little bit more about yourself and how you relate to this topic?
Hi, Alyssa. I'm happy to be here. I have obviously been in the field for quite a while, since 2008, treating mental health and substance use disorders. On a professional scale, this is really my expertise and just the niche that I found myself in clinically. But in addition to that, it is a topic of discussion that's very close to my heart, considering that I have several family members, most notably my older brother, who is diagnosed with schizoaffective disorder. And it is something that we've, navigated as a family and dealt with throughout my entire life, my brother's diagnosis.
Well, thank you so much for joining us today and being able to provide your professional and personal opinion on this topic. So
I'm happy to be here.
Of course. Although schizophrenia is not as common as other mental health disorders, it affects approximately 24 million people, or 1 in 300 people worldwide. Schizophrenia is a chronic brain disorder that causes symptoms like hallucinations and delusions to occur. As of now, there's no cure for this mental disorder, but with proper treatment, symptoms may reduce and increase the chance of fewer or no future episodes. Listen in as we discuss the common signs and symptoms of schizophrenia and how this disorder can affect family and friends. Is schizophrenic disorder hereditary? I know you said that you had multiple family members that have dealt with this.
It is. There is a genetic component associated with schizophrenia and psychotic disorders. On my paternal side, we have quite a few people who definitely were diagnosed with schizophrenia, but even way back in our family timeline presented with symptoms of psychotic disorders. But at the time weren't as, it wasn't as common to get diagnosed.
Yeah. And are there different stages for people with this disorder? Why don't you go ahead and explain to us what it is?
Every mental health condition, for the most part, is what we like to refer to as chronic, meaning it lasts for a long time, and progressive, meaning how it starts is very different and usually exacerbated throughout their life and gets worse without intervention and without treatment. Schizophrenia definitely falls into that category where it is chronic and it is progressive. You already mentioned that it's not curable at this stage. So that in and of itself implies a chronic disorder.
Right. And is schizophrenia something that we treat at Banyan Boca in the mental health program?
Yeah, absolutely. I think that several years ago, and maybe even a decade ago in the field, there was a very hard line between the treatment of mental health disorders and the treatment of substance use disorders. And as research and time has really progressed, I think that hard line is softening, and we're really noticing that mental health is just as relevant for our substance use disorder patients as it is for our patients that are seeking, primary mental health treatment. So at Banyan Boca specifically, which is a primary mental health treatment center, we do tend to treat people that have recently had a psychotic break, that were maybe Baker acted, which means involuntary hospitalization for psychiatric purposes in the state of Florida. And we absolutely do treat those disorders with a combination of medication management, clinical interventions, which are therapy, and structure and accountability within the program itself.
What would you say is the level of improvement if you had to give it a percentage rate from, going untreated with a condition like this to receiving treatment and continuing with therapy?
It's hard to quantify, especially because these things are so specific. Yeah. When it comes to mental health, we all wish that there was just one pill, one solution for everybody. But the reason why the treatment of mental health disorders really should be placed into the hands of professionals, people like Banyan and other facilities that really treat these conditions, is because it is so nuanced. I would say that considering that it's chronic and progressive, zero treatment means things will just get worse. You will not just hit a baseline and maintain that over decades. You will get worse with a condition like schizophrenia or most psychotic disorders. With treatment, you're obviously improving your likelihood of maintenance or even, resolution of symptoms, but that is very case specific.
But obviously, no treatment is the worst possible choice to make.
In my opinion, yes.
How has schizophrenia affected you or your family?
So, my family, we have direct firsthand experience with dealing with psychotic disorders. My older brother, he was diagnosed with schizoaffective disorder in his late 20s. But prior to that, there was the presentation of symptomology. There were behavioral indicators. There were mental and cognitive indicators as well. That really is something that we had to navigate as a family. At the time, I do remember there being a lot of hopelessness, considering that back then I was an adolescent. Right. I don't have the experience and the knowledge as a 15-year-old that I do now. And it was very difficult as a family to navigate an emerging illness. We didn't know what it was. We thought it was depression. We thought it was anxiety. We thought it was typical adolescent rebelliousness and just, how adolescents oftentimes tend to present. And it was very difficult for us to navigate even getting him seen, getting medications, because he was a highly functional individual, extremely smart, excelled in school, and had periods of time where he was better and higher functioning. And if you don't work in mental health like we do, you don't understand the cyclical nature of an illness. You don't understand even the beginning signs and how it can look in the beginning versus how it looks later in life.
So what would you say are some telltale signs and symptoms that it might be something more than just your standard depression, your standard anxiety, your standard teen angst, or what have you?
I think that, in most cases that I've seen, even beyond my brother, a lot of family members have told me that their loved ones have presented as just different. You know what I mean? It's something that people can't sometimes put their finger on. But if let's say we're one of 3 siblings within my family, we have 2 people going through typical adolescent changes and things like that. And my brother was always somewhere else on that bell curve, so to speak. It was always a more severe presentation, even before it became, quote unquote, abnormal. It was a different presentation from what my younger brother and I were presenting that would be more appropriate for that stage. So some early signs of schizophrenia are depression, are social anxiety, are social isolation. A lot of the times the gene that is associated with schizophrenia lays dormant until your late 20s. Some people, it lays dormant until they take a hallucinogenic and it activates that gene. But I would say that, for me personally, I do hear this thing where families are like, I always knew, especially mothers. Moms are always like, I always knew. And I think that it's really important to really pay attention to that instinct and, to try to seek out support and care as early as possible if you have that feeling.
And I know that, we talk about it all the time, that mental health should just be considered health in general. So
that's my thought.
Yeah. It's very important to make sure that, you're getting your loved ones mental health treatment, letting them see a therapist, get evaluated every once in a while, especially if you feel like something might be wrong, because early intervention is key in situations like this.
Early intervention and continuity of care is extremely important. I would say if you are listening to this podcast right now and this is ringing true in your own family unit, get a therapist, get a psychiatrist. Even if the course of treatment changes in 5 years, 10 years, the continuity of someone knowing your loved one in every incarnation of their presentation, I think is very important. There's a lot of gray area between these mental health disorders, right? Schizoaffective disorder is the psychotic component with the mood swings. So it's very common for somebody who has schizoaffective disorder to present, let's say, as bipolar if you're only noticing mania, for example. Even so, someone with bipolar disorder who has high highs and low lows, they can present, if they're depressed for months, they might think major depressive disorder because they haven't seen the mood swing yet. And I think something that really lacks within our mental health care system currently is that continuity of care, is the ability to review previous records, obtaining previous records if they have any. So my biggest piece of advice, if I'm at all giving advice here, is if you have that feeling, get proactive in early care. Get somebody who can follow this case, somebody that, will really take a vested interest in this progression of an illness. I also want to say that teenagers are depressed and teenagers do go through these things. A lot of them do. Doesn't necessarily mean it's going to develop into schizophrenia or a psychotic disorder. But if they have the support and they have a professional involved in their life, then you are more likely to notice the nuances in an evolution of an illness.
Yeah, absolutely. And I'm so glad that you did say that, because you hear so often that it takes years for someone to get truly diagnosed with what their problem is, for that same reason that you're talking about, the continuity, people not seeing the full picture and thinking that they can just sit down one time and get assessed and magically have their diagnosis right then and there, instead of, being able to pay attention and treat the symptoms and see if it's helping. Is it not helping? Are new symptoms arising? If you have a new symptom, maybe it's a different condition. Maybe we need to change course. All that is so important to getting proper care for mental health treatment.
I agree. And it's so common with mental health disorders that people can regress. People can plateau. So they can be doing really well on a medication regimen where they eventually end up plateauing. And if we don't have a qualified professional really monitoring these ups, these downs, or even these stagnant moments, it can be very difficult to get proactive early care. And if somebody does develop into a psychotic disorder, I think that it's really important that they are able to, even if they have to get crisis services in a hospital, but I do think it's really important for them to circle back to somebody who knows their case intimately.
Yeah, absolutely. So I know you talked a little bit, generally speaking, about treatment, using medication and therapy, but maybe you can discuss a little bit more specifically, like how we treat schizophrenia and schizoaffective disorder, maybe when it comes to the hallucinations. Like, what are we doing to treat these symptoms that they're experiencing?
At Banyan, we really do take like a multidisciplinary approach. Basically, what that means is that there's a medical component, there is a social component, there's obviously a psychiatric component, and there is a clinical component through the means of therapy. I think for people that are experiencing an acute psychotic episode, for people that are going through that, oftentimes in Florida, they do find themselves being Baker acted, going into essentially a crisis unit. On this unit, that's where they're stabilized initially with medications. But these psychiatric units, a lot of them don't really offer the intensive clinical services that one needs over a long period of time to learn adaptive coping skills for the management of their illness. They essentially try to navigate them out of the crisis to a point of safety and then pick up, with referrals to other agencies like Banyan for the extended clinical services. So it is very important that if you are navigating this yourself or with a loved one, that you know that medication is not 100% the answer. We have to learn coping skills. We have to learn warning signs. We have to create a support network of what happens if I slip a little bit? What happens if I slip a lot? And we have to have contingency plans in place with our support network. With schizophrenia in particular, a lot of people that have schizophrenia or a psychotic disorder find themselves very alone. It's something that does tend to push people away. It can create rifts in families because it is considered to be something that is difficult to deal with, difficult to manage. It puts a lot of stress on the family unit. So I do think that a combination of family work, in addition to all of this, is extremely important. There has to be support for the family members as well, so they can manage their thoughts, their feelings, their grief associated with maybe having a loved one who does have a chronic and progressive mental health disorder. I think that is essential to the patient as well as to the family.
Yeah, absolutely. So what would you say are some additional resources aside from Banyan that someone could utilize if they're having an issue with mental illness?
We always recommend that our family members, at least down here in Florida, that they're able to go to NAMI meetings. That's NAMI. And they have a huge support network. It's completely free, where family members and loved ones who have mental health disorders can find support through other people, other family members that are going through the exact same thing. So I do think that is an essential service that we're very lucky to have accessible to us here in Florida. And I really just think the more support, the better. I have not ever facilitated a referral anywhere that I can think of in the United States where there isn't some level of support that's accessible for free through the community. I think that sometimes family members might not want to air their dirty laundry. They may feel that the person who's diagnosed with the mental health disorder, that they're the one who needs the help. They're the one who has the problem, and it's not us. And I really think that it's very important for the family unit to recognize the impact that having, someone within their family unit with a mental health disorder and the grief associated with it, support is essential.
Yeah. Yeah, absolutely. Because regardless of, they may not realize in the moment, but they've been affected by this condition as well.
Absolutely.
It can be a traumatic experience for everybody involved, depending on, the level of severity or like where it took their loved one. So it's super important to make sure that you have the support that you need to make sure that you can support your loved one when you're ready to give it to them.
I agree. And I think, I do hope that as a society, we can move towards a place of embracing people with mental health disorders, whether it's schizophrenia or a psychotic disorder or not, rather than ostracizing them from the community and scapegoating them as like this identified patient or the identified problem. I do think that, mental health disorders are here and they're here to stay, right? So we need to find ways to adapt that are healthy for everyone involved. And I really don't think in a lot of cases, just not getting help and not getting support for yourself is indicated. And I know for me and even for my family members, there was a big learning curve and there was a lot of stuff that we had to learn, navigate on our own through adulthood, because no one told us, there's NAMI, for example.
Yeah.
No one told us, there's Banyan. The conception that we had at that time, and, this is probably like late 90s, early 2000s, around there, where his illness really took the next step in his adolescence. And, at the time, we really didn't know where to go, what to do. We didn't know what the problem was, how to access services. It felt, like a brick wall.
Mm-hmm. Especially back then. But
oh, yeah. Well, back then, you weren't as able to just Google things like you are now, and you really depended on people like school counselors, for example, especially in a case that's specific to my family where things started emerging in his adolescence. You're really dependent on school counselors who, serve a major purpose in the system and supporting our youth. But I don't know if they have the same understanding of major mental health. Maybe they do, but at the time, we were not pointed in the direction that we maybe could have been.
So I'm sure all of our listeners would love to know, especially if they're listening to this episode to, figure out if their loved one might need to get evaluated for some sort of mental health condition. Can someone live a happy life with this disorder?
Absolutely. I mean, quality of life is subjective. anyway. So my version of a happy life could differ from your version of a happy life, with or without a diagnosis of a schizophrenia disorder. I do think that a good quality of life is possible. Science, medications, things are evolving every single day to help people with mental health disorders, not even just psychotic disorders. And I do think that with treatment and with maintenance of a mental health disorder, absolutely, somebody can have a great quality of life.
Kahlia, is there anything else you want to add? Any advice you want to give to someone? Maybe they themselves are struggling, or their loved ones are struggling, or they're concerned they might have this condition. What would you like to say to them?
I could just say maybe pay attention to your gut. Even if you're Googling things, even if you're talking to other people and other people are saying, no, it's normal, it's fine, or I went through this, I think that nobody knows ourselves and even our direct family members as well as anyone else out there.
Yeah.
So I really feel that that gut instinct is something very valid and something that should be paid attention to. I would say that the earlier that you can align with a provider, whether that's a therapist, a psychiatrist, whatever it is, consider it like preventative care. Yeah. We all, for the most part, have primary care doctors that we check in with even when we're not feeling sick. Mm-hmm. Why isn't that the same for mental health?
Yeah.
Why aren't we proactive in saying like, hey, I feel like something's a little off. What can we do about this? Sometimes the answer is just monitoring, and just looking at things and continuing to keep an eye on something, and let's see how it develops and let's see how it goes. It's not always just medication, especially early on when a child or an adolescent, when their brain is developing. But I would say really pay attention, and if you feel that something is off, try to access as much service as you possibly can, whether that's community support or private support. I think that continuity of care is essential to somebody being able to have long-term happiness and not get to a point of being in maybe like a massive psychotic crisis.
Well, thank you so much, Kahlia, for joining me today. I really appreciate you sharing your personal and professional experience on the topic.
Of course. Happy to be here.
Of course. And if anybody is interested in any additional information regarding mental health conditions, you can always visit banyanmentalhealth.com. We have a slew of topics on there. We discuss most common mental health conditions. Resources are available there, and you can reach us at any time. So, well, we hope you enjoyed today's episode. Remember that growth and recovery are possible, and it can all start today. Be sure to follow us on Instagram and Facebook at Banyan Treatment Centers, and make sure you're subscribing for notifications of new episodes. And please don't forget to leave us a review. If you or someone you know are struggling, call us today at 888-515-7706. Thanks for joining us today on the Banyan Podcast.